Task force is now urging doctors to screen most of their adult patients for anxiety disorders. Here to talk about that is Dr. Michelle DeBlasi, a psychiatrist at Tufts Medical Center. Good to see you, doctor.
Doctor, it's great to see you. So let's talk first about anxiety disorders. A two-part question. What are they and how do you screen for them?
So to start out, anxiety disorders really come from this immense amount of fear. We all have this sort of innate fear response that has developed evolutionarily to protect us from really dangerous things in our environment. But what happens with anxiety disorders is that fear response actually gets amplified and starts to really negatively impact our ability to function. It might disrupt our sleep, trouble focusing, and can actually lead to more serious conditions like chronic medical issues, substance use disorders, and even suicide if it goes untreated. So that's why it's really important to be screening for anxiety disorders. We have tools that can help with that. Like the GAD, for example, but patients really need to be reaching out to their doctors to get a formal diagnostic evaluation to determine if they have an anxiety disorder.
And when you say, I need to just interrupt, when you say they reach out to their doctors, a lot of people can't even get in to see doctors. So do you mean they start with their primary care?
Yes, I think whoever they have access to, whether that's their primary care doctor, whether that's their therapist, just reaching out for help in general is going to be the most important thing.
You talk with patients every day and they struggle with anxiety. Do they also struggle to get diagnosed?
Absolutely. I seriously think this is a major problem in the United States right now. People are really underdiagnosed with anxiety disorders and are really struggling as a result. Statistics show that only 11% of adults who have an anxiety disorder actually receive treatment within the first year of having symptoms. And a lot of people are struggling. Up to a third of people have an anxiety disorder in their life. And very few, less than 50%, will actually receive treatment. So it is a big problem. People are getting underdiagnosed and also undertreated.
Yeah, Dr. DeBlasi, as you know, the new recommendation applies only to adults between 19 and 64. I mean, why that? Why leave out people who are older than that?
Yeah, I really think this is pretty unfortunate. When they came up with these recommendations, they just didn't find enough research evidence to show that older adults have as higher rates of anxiety disorders as the general adult population. But I do think this has fueled more research that's coming regarding this. And my suspicion is, it's a strong suspicion, that older adults are going to have the same rates of anxiety disorders, if not more.
Sure.
All right, Dr. DeBlasi, thank you so much. Stay well. We appreciate it.